Hello everybody, welcome at ESC TV. My name is Jurrien Berg, I'm an interventional cardiologist at the St. Antonius Hospital Nieuwegein, the Netherlands. And today I'm joined by Ole Frobert, who just presented at the Hotline Session 1 the TAO trial, looking at the effect of thrombectomy in patients with STEMI. So if I can start with you, Ole, can you briefly summarize what your study was about?
The TAO study, thrombus aspiration and ST elevation myocardial infarction in Scandinavia, addressed the hypothesis that thrombus aspiration in STEMI is life-saving. And to this date, there has been no studies powered for hard endpoints. So in order to address this hypothesis, we had to include quite a lot of patients. In total, it was 7,244 patients. And they were randomized 1-to-1 to thrombus aspiration and PCI or PCI alone.
So that's a very large study, far larger than previous studies. And what were the results of your study?
The result or the study came out neutral. So 2.8% in the thrombus aspiration group had died after 30 days. That was our primary endpoint, all-cause death at 30 days. And 3% in the PCI alone group had died at 30 days. And there was no statistical significant difference.
Okay, so what would be your advice to all the interventionalists who still use thrombectomy nowadays and have the feeling that it works?
Our study addressed routine thrombus aspiration in STEMI, and there might be cases where it's worthwhile to do it, but the overall picture was very clear that it didn't affect mortality and secondary endpoints. There were no secondary endpoints that came out statistically significant. There were some trends, but the numbers were very low. So my advice will be that as a routine measure, it's not a future treatment.
Okay. And you just said that the endpoint is at 30 days. We've seen in the TAPOS trial, which is smaller, only 1,000 patients, that the effect on mortality was only seen at a year. Could it be possible that there might be an effect of thrombectomy, not at 30 days, but later on?
If we look at mortality, the mortality curves in TAPOS diverge quite early within the first days and definitely within the first month. And if you look at our outcome, you will see that it's more or less that if you have pancaked the two curves from TAPOS, they are just in the middle. So when it comes to mortality, I don't think we will see anything at 1 year, but our secondary endpoints, stent thrombosis and rehospitalization for a new MI, that was a trend. So we have to see if 1 year data will yield more.
Okay, you're going to look at it. Just a last question. I can imagine that you have patients in whom there's not much thrombus, tortuous vessels, so the effect of thrombectomy is probably small, but otherwise you have patients with, say, big right coronary arteries, high thrombus load. Could we still use thrombectomy in the last patient?
Yeah, I would hope I could be a little bit more forthcoming there, but the problem when we looked at the subgroups, high thrombus burden or right coronary artery or short symptom duration or smokers, factors that would affect or go in the direction of more thrombus burden didn't come out at all as in favor of one treatment compared to the other.
Okay. So we leave out thrombectomy, coming home and doing PCI.
ESC Congress 365 is your free access to ESC Congress content all year long.